Okay,
Hello, I am Dr. Biswas. I am a doctor of this clinic. I confirm that you are Mr. John Boega, 48 years old.
yes, doctor.
Okay, how can I address you?
You can call me John.
Okay, Mr. John, I came to know that you have recently done an imaging of your chest. Is it right?
Yes, doctor. Yes,
Okay, I am going to discuss about your test results and our further management plan with you. Is that okay for you?
yes, doctor. No problem. I want to know.
Okay. So, can you please tell me how far do you know about your condition?
Doctor, I actually don't know very much. I actually have applied for a job. Previously, I did another job, and now I want to switch to another job, and that's why I had to do this X-ray. And then after doing the X-ray, the hospital authority told me to meet you. So I don't know very much about it. I'm quite well, doctor. I don't have any problems with my health.
Okay, that's fine that you are feeling well. And is it okay if I tell that what did we found on X-ray?
Uh, okay, doctor.
And did anyone tell you before this that what was found on the X-ray? Was there any elaborate on it or not?
Well, they just told me that they saw something in the X-ray, and for this they sent me to you. Sent me to you. Yes. So, you can you please help me to know?
Okay. And may I know that do you have any idea why they have sent you or what would be the diagnosis?
Well, doctor, I'm always afraid because I had one relative who died of some chest condition. Okay, so although I don't have any problem, I don't face now, but I am afraid, and also I'm trying to have a job, so I don't know whether if it's serious, well, will it affect my job or not? So there are some issues, doctor. So I want to have some help from you. I want to know more so that you can help me.
Okay, I can understand your fearing. And actually, we did an X-ray of your lung, that is, and that found that there is a small shadow on the X-ray. That is, there is something in your lung. Do you get me?
Oh, I get it, doctor. I get it. But can you please explain more? What is it? Why is this shadow? What will
Yeah.
happen?
Actually, there are a lot of causes for this shadow. That is, it can be sometimes totally a normal condition, and that is sometimes it can be some blood channel. Sometimes it can be some other fluid field structure, and sometimes it also be a serious thing like it can be cancer also. We are not quite sure at this point that what is this.
Oh, doctor, what are you telling? It can be a cancer.
uh, there are just a possibility that it be. I am not hiding anything from you, just it is a possibility, and at this point we are not quite sure that what is this, why is this shadow present on your lung.
So, what can you do for being sure? What's causing this, doctor?
Okay, well, actually, is it okay if I ask you a few question about your symptoms?
Yes, doctor.
Yeah, do you have any cough?
Doctor, sometimes I cough.
Okay. Have you ever coughed out blood?
No, doctor, I haven't coughed out blood.
Okay. And how about your appetite?
It's quite well, doctor.
And have you noticed any changes in your weight recently?
No,
Do you have any shortness of breath?
no, doctor.
Okay. Any excessive weakness?
No, doctor. Not weak, but not weak, doctor.
And do you have any other problem that you'd like to share?
No, doctor. Actually, just I have some cough. Okay. So I haven't produced any phlegm, but sometimes I have cough, and I'm a bit worried now since you're telling that it can be serious. Nothing else, doctor.
And is it okay if I ask you few more personal questions? Actually, very personal question.
Okay, doctor.
Okay. Any of your family member have any history of cancer in the lung?
Yes, doctor. I told you that not cancer, doctor, but I think my uncle has had some chest condition. I think it was COPD. I think.
May I know that if do you smoke cigarette
Yes, doctor.
and how many sticks per day for how long?
10 sticks for the last 10 years, doctor.
Okay. And may I know that what do you do for living?
Uh, Doctor, I have been an office clerk, and now I want to switch to another job. Actually, okay.
What your job actually consists of?
I actually do the typing.
Do you
Okay.
have any history to exposure to any asbestos or any wiring materials?
No, doctor.
Okay. And do you have any pet at home?
Uh, yes, doctor. Why, doctor?
And what is it?
It's a cat, doctor.
Okay. So actually, as I have taken your history, I at this point, I already told you that we are not quite sure that why you are having this condition. And I also told you that it can be a totally harmless condition, and it also can be something serious. And but before I can give you any further management plan, may I know that have you ever had any cyst X-ray or any imaging of your cyst before?
No, doctor.
So, do you want me to tell you about our further management plan?
Yeah, yes, doctor. Of course, I'm eager to know.
Okay. Actually, we are going to take opinion from the doctors who are specialty in the chest, and they will review. After that, you may need to do another imaging test of your chest. That is, we call CT scan of the chest. With that, we will be able to get better idea that what is this shadow in this lung. And after that, we think that we will be able to give you the answer why you are having this.
Uh, will you be sure then, doctor?
Most of the time, it will be able to detect that why you are having this type of shadow. Is it a cancer or not? But it is not likely that it will be able to tell you 100%. And beside that, you may need to do further test. But our next step is to going to arrange a CT scan of the cyst.
Okay, doctor. And okay, and then if it's abnormal, doctor, what can you do? Am I going to die?
Yeah, and as I have told you, actually at this point we are not sure that what has happened to you. It can be totally harmless condition, and even if it comes anything serious, even if I am not telling that it will come, but even if it comes to serious condition, then we always have good treatment option, and we will guide you as soon as possible for your next management plan.
Okay, and doctor, another thing, if it comes out serious, then what about my insurance policies or my job? Will I be able to get a job?
I will discuss this issue with the legal authority and also with the occupational health department, and I think they will be able to give you the best answer that what would be the outcome.
Well, and okay, doctor, and another thing, actually, I asked you that you asked me about some pet. Why, doctor? What's is it anything wrong about the pet? being
No,
at home?
sometimes you have said that you have some cough, and that sometimes can be related to some type of pests, just like some birds. So I have just asked that.
Okay, doctor. And if it's not something serious, then will I be cured? You told that it can be some infection or some blood channel problem or something like that.
Uh,
Are there treatment for that?
okay, Mr. John. Actually, at this point, we are not sure that why you are having this. First thing we need to know that why you have developed this condition and what might be the underlying condition. And after that, we can give you the management plan. And always we will discuss what the test results come out and what would be the next management plan.
Okay, doctor.
Do you have any question?
No, doctor. Actually, you have told me a lot, but I'm still a bit worried about it. So I'm a bit nervous. And okay, and is there anything with smoking? Actually, some colleagues told me that I should quit smoking. So, is there anything that I should do with my smoking?
Okay, actually, smoking is generally it is bad for health, and also it's sometimes uh, related to the condition of the lungs that you have some cough. It also may be related with that, and for this we'll recommend you to stop smoking totally. And for that, if you need any help, we can refer you to the smoking cessation clinic. 2 minutes remaining.
Okay, doctor, and okay, and okay, doctor, that's all right.
Do you have any other concern?
No, doctor, actually, I'm very worried about my job now and whether I can survive if anything comes bad. So I'm a bit worried, doctor.
Yeah, I'm sorry for you, but actually, we will arrange that test as soon as possible, and after the test results come, we can give you the next management plan. And until that, we are not quite sure.
Okay, and well, actually, I'm very worried, doctor. Can you please do it today, these tests?
Okay, actually, we'll take opinion from the lung doctors, and they will do it as soon as possible.
Okay, doctor. So there is nothing you can do today. So, all right.
And is it okay if I summarize you that what I have told?
Okay, doctor.
Yeah, so for your lung shadow, we are going to arrange to take opinion from the lung doctors, and we are going to arrange another special scan that is called CT scan of the chest. Okay.
Yes.
In the meantime, I am also going to take opinion from the professional health department about your job, and also from the legal authority about your insurance policy. Okay.
Okay. Okay, doctor. Okay,
And
I
if
can get it.
and at any point, if you have any question or any concern, then you can always contact us. We are always here to help you.
Okay, doctor. Thanks for your cooperation.
Okay, thank you.
Okay. Okay. So how do you think you managed?
And actually, at this point, that I my task was to explain Mr. Mark about, explain Mr. John about the uh, uncertainty of the diagnosis, that we are not quite sure at this point that what diagnosis could be, and also our further management plan. So I didn't hide anything from him, and I honestly told him that we are not quite sure, and we need to go for the further management plan. And also, it can be something harmless condition, or it can also be a cancer.
Yes. Okay, that's all right. But well, actually, when you talked about smoking, you didn't counsel him at that time. I think you should have done that. Okay.
Actually, I
Uh,
wanted to counsel him about his smoking later.
but I didn't think you missed that. I think at the later part when I myself told that I what about smoking? I think, but I think you could have covered it at that time as well when you asked about smoking. And you could also do it later on, but you were not mentioning it actually. So I actually asked that at the time, and otherwise I think it was quite well. It went quite well, and this is about the diagnostic uncertainty. So you covered all the aspects well here, and the patient. I just want to ask you that whether any travel history and exposure history would have been important in this person.
Travel history would have been asked, but exposure history, I didn't think that anything related to the exposure is related to this.
Yeah, but travel could have been asked, I guess.
Yes.
Travel could have been asked. You asked about other things as well. And another thing, I was persistently focusing on my job. So I think you could have asked that if whether I was economically and socially well supported. I think this could have also.
Yes. I missed that point. I should have
I
asked
was
if
I was
any.
persistently, yes, I was persistently telling you about that I want the job or about the insurance or something. You told that, okay, you will involve occupational health service, but actually I would have like to tell that, okay, I'm not economically solvent at this moment. The COVID era has come, and I have been under great hardship. So I think
Yeah,
this could,
I totally missed that point. I should have uh, introduced that point.
yes. I think this should have been asked, because other points I think you have covered quite well, and I don't think there is much to tell about. And do you yourself want to add anything?
No, I don't know that if I have done anything wrong, you will be better in position.
Okay, so I think it's quite well. Okay. So I think we can stop the recording for this.